Dr. Smith, physical therapist here, and welcome to the total knee replacement video. So you've just had your knee replaced, whether that's your left knee, your right knee, or both knees. This is also known as a total knee arthroplasty, abbreviated to TKA. Now, what's the number one exercise that I think that you should do post a total knee replacement? It's actually getting that flexion back, that bending back. A lot of people have more pain on bending than they do on extension, that kicking out. So we want to break through that barrier first. And again, with proper therapy and proper exercises, and sometimes you don't even need your home care therapist, you can just follow my online training program or reach out to me and you'll be good to go. You may need some outpatient therapy for some manual therapy at some point, but most people that follow my program don't even need therapy at all due to my excellent patient outcomes. So we want to focus on that bending. That being said, sometimes the knee gets stuck due to patient guarding, you being afraid to bend it, which is why we're starting with that. Or sometimes your surgeon just does a bad job. It's just the reality of what happens. That's usually not the case, but sometimes you need to go and get it revised. That's why you have partial knees and so on, and why people have multiple knee surgeries on the same knee. It's not always the surgeon's fault. Sometimes it's hardware malfunctioning and other issues. But the most important exercise I want you doing after your total knee replacement is actually, we're gonna say I have a left total knee, right? You're probably gonna get up like this because you don't want to move it too much. We're gonna use the right knee as reference. So you're laying down home in bed or in the hospital. The first thing I want you to do is to bend your opposite leg, the leg you didn't have surgery on. Now, if you had both knees done, obviously you can't do this, but you get the same principle. And we're gonna try using the left knee to bend. So what we're gonna do is we're gonna keep our heel down, I'll move this towel out of the way, and we're gonna slide and keep sliding and using this as a reference till we finally get here. Again, this is gonna take time. It's not gonna be immediate. And you'll see the demo video I'm gonna post next in the video of my actual patient's status post TKA total knee replacement. But you wanna use this opposite leg as a reference because that way you know what your normal is and where you wanna get to. Another thing you can do if that's too hard is I don't want you to have anyone pushing on it or anything like that, but you can take a towel like this or a strap, and you're gonna do the same thing, put it around the balls on the toe there, lay back, hold it, and then it's gonna force you to come back further. And again, make sure the other knee is bent so you know where to go. If that's too hard, then you can do this to get more of a bend there. Try to hold that painful spot, come back. Now, some people respond well to outpatient therapy with people cranking on the knee and so on, but I do believe that if you follow my knee replacement protocol, which I'll be posting videos and you can reach out to me for a custom guide, that you actually won't even need your home care therapist and you'll be back to golfing, returning to sports in no time. Again, I'm Dr. Smith, physical therapist, and thank you for watching.
Try to bend it so it matches the other one. Good.